Welcome to the Worcester Senior Center. We're so thrilled that everybody's here. Today, we have some wonderful sponsors. We have Linda Belcito from Century Home Care here, and Century Home Care and Vibra created those beautiful Heart Healthy gift bags for you today. We also have Humana in the back who is sponsoring lunch. Thank you very much, Humana. And Linda Belcito will be introducing Dr. Jang Singh. Thank you again.
Hi, thank you everybody. In honor of Older Americans Month, the Worcester Senior Center Distinguished Speaker Series continues with cardiologist Dr. Jang Singh. Dr. Jang Singh is a board-certified cardiologist and fellow of Royal College of Physicians in Canada. He is currently an associate professor of medicine at UMass Medical School and was formerly associate director of cardiology at St. Vincent Hospital. He is now in private practice at Vernon Medical Center. Dr. Singh will speak about prevention and treatment of heart-related diseases and maintaining good health in golden years. This will be an interactive format with lots of time for questions. Welcome, Dr. Singh.
Thank you. Thank you all for coming here on this beautiful spring day. As you see, that I am supposed to be speaking on prevention and treatment of heart disease. Now, you may ask, why should I be talking about prevention to people who are already 70 plus years old? Because all of us have had some damage already done. But I have an answer for that, and that it is never too late. We have shown that it can make difference to your health at every stage of your life. In addition to that, I'll be talking about the hope that all of us have regarding various kinds of treatment that is available that has almost revolutionized the treatment of patients with heart diseases. Can you all hear me in the back? No. Okay. Oh, okay. That's better. Believe it or not, that when I started my career in medicine, the treatment for heart attack used to be to put a patient in bed rest for 3 weeks. And after that, the ones who had survived, they go home, and the ones who didn't, obviously, were a part of the statistics, because there really wasn't very much we could do for patients who have suffered a heart attack or heart-related diseases. But fortunately now, other than having to put up with the stress of health insurance, we have made much more progress in taking care of patients. As you can see, this remains even today a leading cause of death in the United States, and roughly about 600,000 people still die from heart disease, and a larger number continue to suffer consequences of what we call as heart-related diseases, or hardening of the arteries, or heart failure, or diseases of the valves, and abnormalities in the heart rhythm. All these are related actually from one cause, and then we'll be talking more about that. For women, this is of particular interest, as this is the biggest killer of women in the country. People think that maybe cancer is, but you can see that 1 in 3 women die of heart disease, while only 1 in 30 women die of breast cancer each year. So that gives you an idea how prevalent heart disease is, and the common concept that the heart disease is more in men than women, that is not true. However, what is true is that the men get heart disease earlier than women. So what is a heart attack? Basically, simply speaking, when the heart doesn't get enough blood and oxygen from whatever cause, whether this is narrowing of the arteries or because of spasm of the arteries in certain situations, the heart muscle suffers from lack of oxygen and eventually has necrosis or the death of the heart muscle cell. So what are the symptoms of a heart attack? Well, we generally talk about squeezing pressure, fullness in chest, radiation of the pain to the arm or the jaws. For women, shortness of breath is a more common symptom. Patients can feel palpitations, lightheadedness from low blood pressure. So basically what I like to tell patients is it is an abnormal feeling, what you haven't experienced before. If you think this is different than what your normal feelings every day, seek attention. Let the doctors decide what the cause of that discomfort is, rather than diagnose yourself. Because 250,000 patients with heart attacks still die before reaching the hospital. And so therefore it is important that you get to the hospital and let the people who know more about it take care of it. So in simple terms, you know, you all have heard about plaque. So what is a plaque here? And we'll talk a little bit more about plaque and what causes this. And that is the most important thing in the prevention of heart disease. You know, this is not an infection. This does not happen in one day. This is happening all along in your life. And that's what the prevention is all about. And I would hope that in addition to listening to it and acting on it yourself, you would go home and pass the message on to your children and grandchildren. That's where really the prevention starts. Now, you know, I'm a heart specialist, so most of my career I would get to see a patient referred to me because their doctor thinks that the patient has heart problem. I rarely get to see patients who have come to me and say, "Doctor, I want to prevent heart disease. You know, my father died at age 50. I want to make sure this doesn't happen to me." It generally is a 50-year-old father who died, and the son also happens to get heart attack at age 50 or 55, and then I get to see what I can do them. That comes to the treatment rather than the prevention. I think what is important to understand is this word atherosclerosis. Okay. It's the Greek word talking about hardening of the arteries with a waxy material. And this is the root cause of heart disease and hardening of the artery-related diseases. Now, one message that I would like to leave with you today, if you have hardening of the arteries in one part of the body, you have hardening of the arteries everywhere. So many times I would find somebody is being treated for heart disease, but it's been totally neglected that they also have blockages in the arteries supplying blood to the heart. So it is one system. It is like, those of you might have seen old boiler tubes or hot water tubes. You see the inside of the tubes all corroded. So this is one system, all connected to each other. All the risk factors that affect our body, not heart alone. So you have to think about the disease in the large arteries by accumulation of this kind of material. This looks like butter and is derived also from fats. It is butter, it is fat, and it is collecting all kinds of cells inside it, and you can see this, it is kind of become a lump. If you might have seen a lump on top of your skin or hand, it is a lump inside the artery. Nature has provided a lot of protection. Okay, see, this is an artery, but this artery has several layers. The inside is the slippery, waxy inside, so that the blood can flow in it without obstruction. This area in the middle controls the tone of the artery. Now, if you've seen water hose pipe, if you press the hose pipe on one side, the back of the hose pipe kind of jumps around. Or if you have a higher pressure inside, the stream coming from increases. So it's very similar to that. And the outside of the artery here is to give strength to the artery. So nature has provided a lot of protection. But in spite of that, if risk factors are there, and we will talk about them, if the artery is being damaged, this is what happens. So initially, you have a little bit of yellow stuff inside the artery. It's called the fatty streaks, and this starts happening in the age 15 to 25 age group. You would start seeing this kind of inside the arteries. In the next decade or two, that same little streak has become what is called the atheroma, and you have a bigger accumulation. And in the 50 age group onwards, the same thing is now beginning to look like this. And by the time it gets around there, it's kind of hard to prevent further complications. So the whole idea is that this is happening over a 30, 40-year-old time frame. And this is where we need to work. This is where the society needs to change their lifestyle, their eating habits, whatever. So let us look at the risk factors. There are some that you can't do anything about it. We're all getting older. Men are likely to suffer earlier than women. And family history, there's nothing you can do. You can't choose your parents. So if somebody is carrying bad genes and has donated them to you, it's your bad luck. But other than that, you know, lot of work is being done in this area to be able to find the genes so that you can select people who may be more prone to get atherosclerotic or hardening of the artery type of disease, so there can be emphasis on those people to treat them earlier. But you know, this remains a problem. This is, you know, looks awful good, but people have to change habits. So what are the controllable risk factors? The high cholesterol, high blood pressure, smoking, and very importantly, diabetes. Now, diabetes in this country is increasing like an epidemic. We're all worried about COVID, but people are dying from diabetes and strokes and heart attacks, and a lot more people die from that, but we are all going around wearing masks, but we won't change our lifestyle so that we don't. So this is sort of a silent killer that is progressively working to inside us without our knowledge and eventually strike a blow, which generally is not good news. Other risk factors, obesity, sedentary lifestyles, high stress, and all that. You know, right now, 60% of the country is overweight, and about 50% are in the category of obese. You know, we do it to ourselves, and is a very treatable, preventable condition. But it has not really started sinking in, and no politicians are talking about obesity. They're all talking about COVID and the vaccine for COVID to prevent COVID. But I think we need a major emphasis for people to start talking about obesity, because obesity leads to high blood pressure, high cholesterol, diabetes. All these are indirectly related to obesity. Now, this is what I was referring to, the genetics, familial hypercholesterolemia. People who have that, they generally get a heart attack before the age of 40. Fortunately, we have some drugs that can delay this, but obviously this is not going to be 100% prevented. Advancing age, I think it's a good thing that we're living longer, but you want to live longer but healthier. You don't want to live longer necessarily in a nursing home, but you want to live longer in a healthy fashion where you enjoy your older years in some way or the other. Women after menopause become more susceptible to heart diseases. All right, this is just to show you that how this cholesterol thing works. People eat cholesterol, it gets absorbed, goes to the body, causes hardening of the arteries, eventually ends up in the liver, and liver gets it out through the bile system out into the out of the body. So we have a little bit more we've talked about hypertension and cigarette smoking. These are highly preventable situations. There are other things. You've seen people like that. They continue to smoke. They generally have this guy generally has almost 100% of the time a diabetes, and it also has high blood pressure, and his cholesterol is high. As a result of that, he is a sitting target for getting heart disease in the near future. So let's just look at what this cholesterol is all about. It is essential in the body in the early years because it is a part of the cells, the development and all that. But once the development is finished, we do not need to continue to consume cholesterol because the liver itself, the body makes enough cholesterol to take care of daily needs. So we have the good cholesterol and the bad cholesterol, and even a component of this is triglycerides, which are bad. These are mostly related to high carbohydrate intake. High carbohydrate intake is all the white stuff, white bread, sugars, all the pastries, all that is related to the triglycerides. Low density lipoprotein is the one that goes and gets deposited in the arteries. It is bad. The higher the low density lipoprotein, the worse off you are. And then you have the high density lipoprotein, which is called the good cholesterol. Fortunately, the only things that work on good cholesterol to make it higher are losing weight and exercise. These are some things that you can do yourself, doesn't cost money, but it's as good as any expensive medicine to do it yourself. So the numbers of the cholesterol, less than total cholesterol, less than 200, triglycerides, less than 150. And if somebody has a lot of hardening of the arteries, we try to get their cholesterol, LDL cholesterol, below 70 or even lower, because as I said, it's never too late. With the number of powerful drugs that we have now, we have shown that by markedly reducing cholesterol and controlling other risk factors, you may not prevent it, but you can certainly delay the consequences of hardening of the arteries. So this is an important thing to remember, that you should know your numbers. Most time I get patients, they don't know. They have had a cholesterol done. They say, oh, your cholesterol is okay, that kind of thing. But I want you to, when you go to your doctor next time, ask him to write it down for you as to what your numbers are, and make sure your numbers are in good range. Now, what is to be avoided? You know, the number of types of fats, we cannot do without fats. I mean, our daily living and all that, I don't tell people to make their lives miserable and start eating only lettuce, because that's not doable. Eventually, if you tell somebody to go on an unreasonable diet, they will get off that, and they will not, it'll work. Or they'll change their doctor, who'll probably be more compliant with their desires. But I think it is important to understand that you can live normally as long as you follow the certain rules. And the rules are that, you know, there are good fats that you can use instead of the bad fats. So the monounsaturated fats like olive oil and what you have in the nuts and the canola oil and avocado, all these kind of, if you have more of good fats and less of these bad fats, you obviously can have a fairly palatable and nutritious diet. Now, meats, dairy, eggs, all that fried food, I think, you know, you don't need to become vegetarians. You need to have small amounts of food. 4 ounces of meat, 4 ounces of chicken or fish, couple of eggs a week, avoid fried food, avoid processed foods, and I think you will be able to come up with a fairly good meal plan which you can live with. The most important thing, however, in all of this is that we must remember, and that is how much you eat. You can eat too much of good things also. So, calorie control, that is probably the most important thing that you need to remember. So if you're eating 4 slices of bread a day, cut it down to 2. If you're eating 8 ounces of meat, cut it down to 4 ounces. But continue to enjoy all that you enjoy, but cut down the number of calories. That is most important. People come and say, oh, I eat a lot of chicken, or I eat a lot of that. Problem may be that you're probably eating a lot of that. So, calorie, number one thing, calorie control is the most important thing in a nutritious diet. Now, blood pressure control. You know, younger people have blood pressure in this range, 120 by 80. Then it starts going up, and you can see that there is a pre-hypertension and a hypertension. And now, there is no reason that the blood pressure should go up as you get older. Okay? Now, run like hell if your doctor tells you your blood pressure is good for your age. Okay? There is nothing known as that, and I know I have heard that many, many times, and it used to be even in the books that as you get older, the blood pressure goes up, and that's a part of normal. It is not normal. Once the blood pressure starts going up, it means your arteries are becoming harder. They are less elastic and therefore put more pressure on the heart, and therefore the blood pressure goes up. Your goal should be to keep the blood pressure closer to 130 by 80 range. That is the goal for most people. And as you can see that if blood pressure is 10 millimeter higher or 20 millimeter higher in the systolic, the risk of the heart disease doubles. So it's something easy to do. Control your blood pressure and know your blood pressure. So ask your doctor to write down the blood pressure for you and not accept so control. Okay, it has to be controlled, and it can be done. There are plenty of medicines, and with the cooperation of the patient and the medicines, almost everybody's blood pressure can be controlled. Well, then there are general things we've already talked about. Not too much drinking, physical exercise, walking, brisk walking, that is adequate. Nobody needs to run, nobody needs to damage their knees, just brisk walking, whatever your body tells you. And just what my message to my patients is, listen to your body. Do according to your body. If you get tired, stop and go for another walk later on in the day. And slowly you will find that you are able to do more and more as you are doing it more frequently. So you condition your body into a more efficient machine over a period of time, but you have to work on that. Once again, I would emphasize to you the diabetes. It's the greatest killer, the greatest silent killer. It has a major effect on all that we talk about, atherosclerosis. This is one of the, at least in developed societies, this is one of the major causes of hardening of the arteries. So there are treatments available which were not available before, and we can do a lot for patients if in spite of all that they do get sick. So there are lots of medicines available, and then there are fancy stuff that we talk about. So the other message that I would like to, we have all these drugs, the blood thinner types, the beta blockers, which have been used since early 60s, ACE inhibitors for blood pressure and protection of kidneys, cholesterol lowering drugs, nitroglycerins, and there are other drugs for angina and all that. So as you know your blood pressure, know your cholesterol numbers, know your medicines. All patients should know what they are taking, why they are taking it, because of the side effects, because also the number of times your pharmacies make mistakes and number of times the drugs get changed and the old prescriptions are not cancelled and you continue to get sometimes double the amount of medication, sometimes half the medication. So it's important for you to know what medicines you are taking, how much are you taking, and why are you taking. That should be your responsibility to make sure that you do that. So talking about the fatty streaks here, slowly increasing here, and getting to this stage where they block up the artery. Not only they block up the arteries of the heart, but you have hardening of the aorta, which is your major artery in the body, the arteries in the leg and the back of your knee, artery going to your head right here in the neck, and the arteries inside the brain. So there is plenty of evidence to show that if you take care of your blood pressure, if you take care of your cholesterol, if your diabetes is not there, you can prevent or delay dementia, which in many cases is due to small strokes. When you do CAT scan on somebody, you will find these little shadows. They have had these small strokes which they have not been aware of, but cumulatively, over a period of time, there are enough small strokes that then the brain begins to lose its connections and the beginning of dementia or what is commonly called Alzheimer's disease. So it is taking care of the whole body, not just the heart, that I would like to emphasize today. You can see that this is your aorta, this is the artery of the neck here. These are the arteries, other arteries going into various, and these are coronary arteries, and this is in the your artery of the leg behind the knee joint. Generally, where the arteries bend, it's like if you might have seen copper tubes or something like that. If you bend them repeatedly, continue to bend them, eventually they crack inside, and that's when the clot forms. And that's what happens to arteries which are located at places where we bend. All right, for coronary arteries, you have all heard about cardiac catheterization and stents and balloons and all that kind of stuff. Now this all started around little after year 2000. We started working on this in 1966 onwards. Much progress has been made, and now you can see, now this is the fat blockage inside the artery. You can put the balloon inside, which is wrapped around the balloon is what we call a stent. This is made out of stainless steel wire most of the time, and you open up the balloon, and remove the balloon and kind of push the walls away and open the artery. The name stent would be interesting for you to know. Was a guy named Dr. Stent. He was a mining engineer, and he came out with this for supporting the walls in the mines, so the mine walls don't collapse. And this is named after him. It is not an actual word, it's a name of Dr. Stent, who created that concept. You can see this is one of the arteries of a patient who having a heart attack, and you can see there is the blockage. This is the artery, normal artery here, and this is the blockage here, and that's the kind of thing that you look for when we do the angiogram and put a stent there. For patients with irregularity of the heart and slow heart rates or fast rates and heart rates, we have come up with all these pacemakers and defibrillators. They're very, very effective in proper cases and nothing to be afraid of. They're done routinely all the time. If they are needed, get it done. It's a relatively simple procedure done without anesthesia. We put the wire inside the heart and put the battery under the skin. This is a pacemaker with the wires. Now, the other problem that occurs in mostly elderly is the valve problems. So the blood comes on the right side, goes through the lungs, goes to the left side, and then goes out into the body. So heart is a pump, and the pumps have valves, so the blood doesn't fall back into the pump. So there is mostly in elderly population, you have the what they call the aortic valve, and so now we have mechanisms available where about half the patients with the aortic valve problems can be corrected with a procedure like catheterization. It's an overnight procedure and done without cutting the chest or major surgical intervention, and you can put the valve inside here with a balloon and open it up, and has become a standard acceptable procedure in several institutions. Similarly, mitral valve can leak. That is the valve that protects the blood from going back into the lungs, and there are procedures now available to fix that also. Atrial fibrillation is a very common thing. A lot of you might have heard about it. It's irregularity of the heartbeat. People can suffer from it in terms of palpitations or shortness of breath and all that. And there are ways to treat that available. The blood thinners are available, which are very effective and prevent which the common complication of atrial fibrillation is strokes, and this giving blood thinners can prevent strokes. So you think of all these risks for the stroke are very similar to the risks of heart disease, because they're all basically related to the one common tree, and that is atherosclerosis. So just remember atherosclerosis. If there is hardening of the artery in one place, there is hardening of the arteries all over. So if somebody diagnoses you to have one hardening of the artery, ask them to screen your body for the rest of the blockages. So in summary, atherosclerosis, cardiac disease, coronary disease is all very preventable. And if it's not preventable in some situations, is quite treatable, and we have a lot of ways we can make life better. But the things that you need to do and take responsibility are the modifiable risk factors, and that is my patient's responsibility. The patients must take responsibility. It's the doctor and the patient together who can make life better, not just the doctor and not just the pills. Some people have a tendency to give me a pill for everything. It doesn't work like that. You have to be a cooperative, compliant patient to get the best results. So watch your diet, exercise, smoking, and weight loss maintenance as close to normal as possible. So after that, we'll all be hopefully left with a healthy heart and a smiling heart,